I'm Larry Gilson, Chairman of Focusing Philanthropy. I'm sending you this video from my home in Los Angeles. I've actually never sent a video before, but I'm doing it now because the situation calls for us to break out of our normal mode of operation and to do all we can to address the situation with which we're all grappling. We're doing everything we can here to try to maintain safety and health for our family. And I very much hope and pray that you're doing the same where you are. At the same time, I know that many of you, a great many of you, are also experiencing the impulse to try to help others even more than usual. This is not a theory on my part. We know it's the case because so many of you in our Focusing Philanthropy family have reached out to us and asked for suggestions of what you can do to be most impactful at this time of global calamity. This is an incredibly flattering question that you're asking us, and we've worked hard over the last several weeks while our whole team has been at home to try to find the best and most compelling answers to these questions. We now have 3 specific suggestions to propose. First, in the United States, we advocate that you support a program that we have now put together to provide healthy meals to millions of people. This is built on the back of 8 years of institution building and scaling of a network of organizations around the United States that provide training and food production for people in distress. We now are in a position to scale that to hit the highest numbers possible in this emergency. Internationally, we're focused in the Southern Hemisphere, where the COVID-19 impact has not yet peaked. We have a perishable opportunity to get ahead of the problem to a reasonable extent in that part of the world where most of the world's poorest people are concentrated. Internationally, we have 2 companion suggestions. First, there are hundreds, if not thousands, of small and medium-sized health clinics in the developing world that themselves lack clean water, sanitation, and hygiene. You can imagine the consequences of this for the doctors, the rest of the medical staff, and the patients who look to these facilities as a safe place in which to get help. And in fact, there's a risk of infection even there. The plan in this instance is to install these systems, water, sanitation, and hygiene, and we've already identified, vetted, and are ready to move immediately to do so at least 60 clinics in 9 countries in the developing world, with the capacity to surge substantially more to the extent that resources are available. And finally, where clinics are even out of reach, the objective is to expand communication capacity to help community workers who are already in the neighborhoods and to deal through telemetry for the many people, the majority of people in Africa and South America and India who, despite poverty and remoteness, still have cell phones. In each of these cases, the intention is to communicate substantially accurate and substantive and timely information about the onset of the virus to help identify and respond to the problems as they arise, and to receive inbound queries about what should be done in the face of symptoms that appear. This collection of communication tools is already well tested. We had teams on the ground in Mali and Malawi just in February to analyze and observe, and we're now ready to recommend this as the 3rd prong of our 3 elements of a response. So we advocate meal production at dramatic scale in the United States through a proven network, the strengthening of health clinics in the developing world to respond to the crisis in a safe and clean environment, and the communication of accurate and timely information even beyond the reach of medical personnel in their traditional roles. These 3 together can have a profound impact, and all of them are built on the back of the same rigor, process, and discipline that we consistently employ in all of our recommendations. At this time, I appeal to you to consider surging your donations to the maximum extent that you can. We have an unprecedented need, and we need to have an unprecedented response. Thank you very much for your attention. Please do everything you can to stay safe, and I appreciate your support and encouragement.